This meeting is called to order at 11:26. The first order of business is roll call.
Powell. Here. Kokendorfer.
Here.
Gershenson. Here. Nelson.
Here.
Taub. Here. Lukes.
Here. We have a quorum. Please rise for the Pledge of Allegiance to the flag. I pledge of allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Next item is approval of the minutes. Are there any corrections to the minutes of the previous agenda? If not, we need a motion to approve the minutes of the Healthy Communities and Environment Committee of our last meeting, March 18th. So, motion by Commissioner Kokendorfer, seconded by Commissioner Powell. Any discussion on the minutes? If not, all in favor signify by saying aye. Aye. Opposed? The motion is carried. Next is approval of the agenda, the communications from Michigan Department of Health and Human Services Board minutes dated March 19th.
First we need approval of just the agenda for today.
Oh, let me go back. We need an approval for the agenda for today. Do I have a motion? By Commissioner Nelson, seconded by Commissioner Taub. Now the approval of the communications, A and B. Oh, I am moving too quickly, aren't I? I need a motion to, we need public comment. Is there anybody from the public wishing to address this board? All right, seeing none, public comment is closed. Then a motion to receive and file the communications, Michigan Department of Health and Human Services Board minutes dated March 19th, and Health and Human Services fiscal year 2019 to 2020, Michigan Department of Environmental Quality, Oakland County Beach Monitoring Program grant application. Are you moving or you have a question, Commissioner? Moved by Commissioner Taub. Who's seconding by Commissioner Powell? All in favor signify by saying aye.
Aye.
Opposed? The ayes have it. Now we move on to the regular agenda. We need a motion to explore expanding the services of Youth Mobile Crisis Team to all children and youth in Oakland County. Moved by Commissioner Taub, seconded by Commissioner Kokendorfer. Yes. Yes. Mm-hmm.
Okay. I just want to hear about it. I don't know. What is it? I'm sorry, I don't have any information on that.
That's a very good question. May I stay here, Madam Chair?
Yes.
Would you like? Okay. There is a mobile unit that's supported by funding from Medicaid / and/or Medicare, and it consists of two people. And you're going to have to forgive me. I don't remember. I know one's a social worker, and one could be an intake person, but two social worker or psychology type people. And when there is a crisis in a home, and there are crises in homes in Oakland County, okay, they go into that home to try to bring it all the anxiety down and to help usually the families, refer them to the proper places for services. As we know, we've had a lot of overdoses in this county in homes. And so it is part of what we used to call, let me just bring this up if I can find it on my computer. We used to call community mental health, now I've got it right. We used to call it the Community Mental Health Board. It's now the Oakland County Health Network, okay? But that's basically it. So it's a mobile crisis team that goes out for children and youth in the county. And it's a wonderful thing, okay? And I don't disagree with it. It's fabulous. What I'd like to know, and I don't know the answers, that's why I put the resolution out here. What I'd like to know is what it would cost to expand it to other people in the county, okay? If it would be covered by Blue Cross or Aetna, I'm just throwing stuff out there. Because a crisis is a crisis, and I don't think people much care who is in crisis. They just need help. And so that was my concern. So all I'm asking today, and I think it's in the now therefore be resolved, that we support this, obviously, we would support for any children, and that we ask this organization, the mental health people, to come in and tell us what they do, explain it better than, because I'm not the best, yeah. And, thank you. This is it.
Right.
And-
Right now, Community Mental Health contracts with New Oakland to provide the
Right.
mobile services
Right,
to the
exactly.
Medicaid and indigent
But we need to talk to them
population.
and need to talk to New Oakland and just get a discussion going as to what it costs to do it. Everybody would not, who has a crisis in their family, would probably not want this. They may have their own people they can go to. But I think it would be a wonderful service to be offered if we can find a funding source for it. So that's it. So it would, and this is a very good thing. This will tell you exactly what it is. There's an 800-877 number, which is an 800 number. And, you know, as I said, there's all kinds of problems that people have, and it doesn't have to be anything where people are throwing stuff and screaming and yelling. It could be things, as they say here, like social isolation, where parents just don't know what to do. And a lot of parents, most of us, are not equipped for this. We need professionals. So this is not asking you to do anything but to bring these people in so we can learn more and figure out if this is something we want to have it apply and how it would be paid for the rest of the county.
Right, it's a report. Presently, what we would do is ask for a presentation by
Right.
New Oakland and.
Yeah, it's real easy. It's not,
Oakland County
we may
Health
decide
Network.
this is something we don't want to do. Just leave it up to, you know, a handful of people. We may decide we're going to look into it, find out if there's a crisis opportunity in other private insurances or what have you. And there are people in this county who could pay for this service if they knew it was available. Okay, that's it.
Right, thank you. Any other questions or comments? We have a motion, we have a second, we need roll call, please.
Powell,
Yes.
Kokendorfer,
Yes.
Gershenson,
Yes.
Nelson,
Yes.
Taub,
Yes,
Lubes.
Yes,
thank you.
the motion is carried. Next item is a presentation by the Department of Health and Human Services about the Oakland County measles outbreak. Welcome.
Thank you. Good morning. So we're passing around kind of a one-sheeter. You all had requested this at the board meeting or at caucus, and so it's basically an overview of what we've seen what we've seen over the last 3.5 weeks. Some accomplishments or, you know, just some statistics of what we've done in the community, just to kind of let you know. And some important points to remember, just if you're out in your community and people are asking questions, it's just an easy facts for you to have. So basically, some of the things we just wanted to make you aware of, we're actually up to 38 cases now in Oakland County, 39 total in the state of Michigan. We actually added 4 on Friday. It is the highest number that we've seen since 1991, and as you can see, we actually had 65 cases in Michigan in 1991. The age range is 8 months to age 63. Most of the cases are adults. It's very different than some of the other outbreaks that we have seen. And actually, today, we actually started our first exclusion for schools. So you may have noticed that I think it's Derby Middle School was one of in Birmingham School District. And also we had a daycare too that was identified in Hazel Park where exclusions actually were started today. So what that means is any child that does not have 2 doses of MMR, at least in school-age children, they have been excluded for school for 21 days from day of exposure, which is actually April 22nd. So, and then the daycare, we had some infants that had to be excluded, obviously, because they are not vaccinated. And so they are excluded actually until April 24th. We've given a little over 2,200 vaccines since March 13th. That has been amazing. The community has really accepted us into the community and really gotten vaccinated, so that's good. We've done 9 press releases. The majority of those now will come from the state of Michigan because it is a multi-jurisdictional outbreak, we will do updates if there's locations that may not be in the press release from the state, but generally those will be coming now from the state regarding cases and locations. We've done 16 special vaccination clinics. We've been out to Young Israel, which you may have seen in the community. We have had weekend clinics. We came over and did our legal counsel for a special vaccination clinic, and we also were here at the courthouse due to an exposure. We've had a lot of calls from Nurse on Call. We've actually done over 1,500 calls just directly to Nurse on Call related to measles. So they're pretty busy right now, and
that doesn't include the 500 calls that we
right. Yes, quite a few calls. So just some important points to remember, and again, we've got them here. Measles is highly contagious, and it can make individuals very ill. You'll hear people say it's just a rash. It's not just a rash. We have seen some very sick people in the community. A very important piece is if people are sick, really they should be, stay home, and that's with flu. I mean, that's with any kind of sickness. We can keep the spread from happening if people can actually stay at home, and that's very important with measles. If people worry that they have been exposed or have been at one of those locations, they should stay at home, and even not have others over to their home, right? Because if they're ill, they can easily spread it. The most important piece is we're asking people to have 2 documented doses of measles. And so there has been a lot of questions about, well, I'm not sure if I had 2 vaccines when I was a kid. Really, up until 1990, there was only 1 dose of MMR that was suggested, or what they called up to date with your vaccine status. So if your pediatrician did not catch you up as a child, you may only have received 1 dose. And so we're really encouraging people to know their vaccine status. And if you don't know if you've had 2 vaccines, to get in and get vaccinated. So you can get it at your physician's office, or we are open Monday through Friday and some Saturdays at our we charge, the actual dose is $71, but if there's any exposure, there is state vaccine that is available, and it is free of charge. So there is an assessment that we will do, and if there is any potential exposure, then we will offer the free vaccine. So again, if you think you were exposed, this is important. If you can get vaccinated within 72 hours, that can keep the disease from happening. And then also those that are maybe high risk or immune compromised, there is IG that we can give within 6 days that will help reduce the chances of getting the disease. We're working with OBs all the time for individuals that are pregnant that may have been exposed. So we've opened up a really good relationship and started a great relationship with them. And the 2 really important things is that you can get the disease 21 days after you've been exposed. So you'll hear us say, excluded for 21 days. So we ask people to actually watch for signs and symptoms for up to 21 days. And a very important piece is that if you are sick, do not show up at your physician's office. Do not show up at an ED without calling ahead of time. Because again, there are precautions that they can put in place. Masks, or putting people in a special room, routing them around a different way. If you're sick, we've had pediatricians and even physicians that have gone out to cars to swab people for testing instead of bringing them in and potentially contaminating or infecting those that are actually in the offices. So I guess we'll open it up to questions. That's what's actually on your handout as well.
All right, and Commissioner Taub had a question, followed by Commissioner Kokendorfer.
Okay, so for those of us who think, and we're very old, that we got the measles, are you offering? What are your suggestions there?
So anyone that was born prior to 1957 is the date that we use, are considered to have immunity from measles. But during this outbreak, we're really suggesting that you have a conversation with your physician, obviously, but the most important part is to get vaccinated.
We do have cases that were born before 57.
Yep.
And also, quite frankly, your mom told you had measles, but there are different types of measles. So, German, soft or hard, or however it was identified at the time. People may remember measles, but maybe it's not this type of measles. So, if you want to be safe, get a vaccine.
Thank you. Thank you, Madam Chair.
Thank you.
Yes.
Well, thank you very much for both of you and your entire department for being on this and for all the work you've done and late nights that you've had. So I've got an unfair question here. Is there any sense that we're near the peak or peaking based on the rate of new cases? Do we have any idea?
That's a really difficult question to
I know.
answer. We have
I know.
epidemiologists that burn the midnight oil, trying to look at, the ebb and flow of it. And that's really hard to tell. We know that when you have an index case, a certain number of days will go past, and then you'll start to see what they call the first wave. And then there's the first wave that's staggered over a number of days, weeks even, and then all of their exposures. And then there's a second wave, and then a third wave. But the time between the waves is supposed to get shorter and shorter. And it's very difficult at this point to tell where we're at.
Got it. And as I apologize for my ignorance, is there anything seasonal about measles at all? No.
I don't know that we know that.
Yeah, I don't know either.
Okay. And then lastly, I know it's early, we're just in the middle of this and we're focused on actually treating this and cutting it off, but I mean, is there any sense of a cause of why we're seeing the numbers that we haven't seen in, decades?
Yes.
Is it the anti-vax movement, or do we have
It's-
more people who haven't been vaccinated? Why?
It's twofold, really. We live in a very global society. Travel from Oakland County to Italy or Germany or Israel occurs every single day. A lot of travel back and forth between countries. Japan is also experiencing a large outbreak. So South America, we had a heat map done and looked at all the hot spots around the globe, and it's everywhere.
Really?
So that's the beginning, this travel back and forth. And then now with the growing complacency about not vaccinating, there's a lot of models out there that'll show you at certain percentages of vaccination rates for measles, what an outbreak could look like and how fast it can spread through a community based on the vaccination rate you have. We have one of the highest waiver rates in the state. So that's a problem.
Yes, it is.
And then once it gets a foothold, it becomes a problem even for those that were vaccinated because of the number of exposures and what your body has to do to work against that.
And that's the concern, right? That was why I asked about the peak. Is does this sort of build an inertia that the more cases you get, the more continue to come along?
Absolutely. And then we look at the outbreaks that have occurred across the nation in New York and Washington and Oregon and other places. They aren't fighting it for a few weeks and they're done with it. It goes on and on and on, and New York's been in the thick of it for months.
All right, thank you.
Commissioner Powell?
Yeah, I may have stated it, but I just probably missed it. Are all the cases still South Oakland, majority of them?
The majority of the cases
Yeah.
live in,
Yeah, that's what I'm
South
saying, they
Oakland.
still South Oakland,
Yep,
okay.
South Oakland.
But it's
Okay.
only a matter of time before that.
Oh, yeah, no, I know it can spread, I was just trying to see where are the 38 so far concentration, and it's South Oakland County, okay. All right, thank you.
Any other questions? Commissioner Todd?
This is a scary question for me. If kids are not getting vaccinations, they're also not getting polio vaccinations. Is that correct?
Well, that's the other thing we're seeing is that parents pick and choose. And MMR is one of the ones they're most worried about because of the paper, the Wakefield study that came out a number of years ago that has been claimed not appropriate.
Well, the
and-
man lost his license,
Yes, he
medical
did.
license,
But
yeah.
that still started a movement. And the people thinking that there's a relationship between MMR and autism is the thing that is really driving. We see parents all the time and educate them because they have to come in for waiver sessions. And they may choose to do a number of vaccines, especially after the waiver session, but that one vaccine may be the one they still opt out of.
Are those available in separate doses as well? It just comes in a single dose of measles, mumps, and rubella,
Yes.
correct? Okay, so you couldn't separate them out anymore. They used to come separately.
And they do combo vaccines now because they've studied, they've done a lot of studies about certain combinations of vaccines elicit better immune responses, and this is a very good combination. The other one that you sometimes will see is MMRV, which is measles, mumps, rubella, and varicella, which is chickenpox.
Chickenpox, yeah.
You see that less frequently.
So it's altogether possible that the kids who skip the MMR could conceivably get mumps, measles, both kinds.
Yep.
Yeah. So they could end up in quite a lot of difficulty. Is that correct?
Correct.
Okay, should they not get, so the same kid that's got measles at Derby could one day end up with other things, and that's a whole school, isn't it?
Yeah.
How many kids in that school? About?
I don't know.
I'm not sure.
Okay, so they've all been exposed before Easter, or whatever vacation this was, before spring break, to mumps, measles, and rubella.
No, they've been exposed
To
to measles.
measles. Measles,
The
okay.
confirmation was for measles.
Measles, okay, so every kid in that school could conceivably come down with measles who hasn't had a vaccination.
We're hoping that those that have had 2 doses stand a much better chance of not getting it. But there will be cases, and have been, where people with 2 vaccinations may still get it. And, you know, that's another battle that we fight, because people point to that as the vaccine's not effective. But when you can see the vast number of people that never get measles that have 2 doses, I think there's plenty of evidence that shows how effective it is.
Commissioner Powell?
So you have mentioned about the children. How are they handling the impact as far as the number of days that they may miss from school? How is that looked at on such an illness? I know it may, okay, we're talking about measles, but I think the same process would be in place for any major illness.
Yeah,
So how
each
does that
disease is
work?
a little bit different. It basically
really?
is, what is the time it takes to show signs and symptoms? So what is the longest date? And so for measles, it's 21 days. We just had this conversation this morning. So each disease may be a little bit different, but so basically from the 29th, you have to go 21 days out, and that's, you actually start the next day, and then you go 21 days out, which actually puts you to April 20th, right? So their first day back at school would be the 22nd. So it's 21 days.
How is the state, like, how is that child excused? Like, wouldn't that be, I mean, because a child is only allowed so many days to miss. Be it it's a medical, is it excused because it's a medical? Or how is that in?
Don't know.
I'm not sure how that works on the school side of it. They're just excluded as part of the
I
public health
think
code that
when
requires
there's
it.
a health reason for a child to miss school, there are opportunities to make up that work.
Okay.
Is there a blood test that would tell somebody if they were exposed prior to getting an immunization?
Are you talking about a titer?
Yes.
Yeah, so there is a titer, but there are problems with that. If you catch it at a certain point, your titer could give you a reading that makes you think you have immunity, but maybe you don't. Labs handle titers differently. It's difficult to interpret. There's also schools really strong evidence that shows that during an outbreak, you may need to have a higher level on your titer to make you immune. So the state is highly discouraging the use of titers to say whether or not someone is immune. They are simply saying, go get the vaccine.
Thank you. Yes.
I'm a little confused. So the kid at Derby, okay, when did he come down with measles, or she?
The first day of communicability was March 29th, which was the Friday before spring break.
Oh,
So-
so he came to school and had measles, or she?
No, didn't show signs of it yet,
Yeah.
but they're communicable 4 days before the rash appears.
Oh,
That's the
okay.
difficulty here, which is why
Got
we
it.
have the 21-day exclusion, because you may not even know you're walking around with measles and you're communicable until
4 or 5 days.
finally the rash appears, and it's too late.
And so every place that child went, in Birmingham, Southfield, Troy, I'm just making that up.
You're
Yeah,
exactly
they're
right.
spreading that disease.
And that's exactly what our epidemiologists do. They spend inordinate amount of time with each and every case, going through, having them go through receipts of every place they've been and helping them think through those days and really having conversations to try to spur their thoughts and memories about where they've been. I don't know if you saw it, but Paula Tupman did a great piece about that last Friday.
Friday, yes.
And she did a great piece about what our EPIs do, and we appreciate her explaining that to the community. If you haven't seen it, we should send you that link.
Yeah.
Our nurses and our nurses also help. They'll get on the phone and basically just walk through, okay, what did you have for breakfast that day? And that kind of helps them remember, okay, did I go out to eat? And what did I do that day? Did I have a doctor's appointment?
They
Look
go
at receipts. So,
shopping.
yeah, so it's.
Holy cow, okay. Thank you,
Yes.
thank you, Madam Chair.
I was just gonna request, could y'all please send that to us?
The link?
Yeah.
Cause that'll help us in our district, so it kinda help.
She did
How
a
about
great
we
job.
send it to Chris and he
You
can
know, that's what I was gonna say.
send it to
Send
everybody,
all of
yeah.
us, so
Okay.
we
Right.
just have it in our little folder.
Thank
Wow.
you. All right, we need a motion to receive and file this report. Move, a motion by Commissioner Kokendorfer, second by Commissioner Powell. Thank you very much.
Yeah, and one more thing, if you didn't see Flashpoint yesterday, there was a great roundtable discussion, and Shane Buys, our administrator over public health nursing, and our close partner at OU, Mark Navin, that we've done a lot of work with, they were in the roundtable. It was a really great discussion, too.
Thank you.
Shingles.
Is there any further business to come before the Healthy Communities and Environment Committee? If not, without objection, I declare the meeting adjourned at 11:56. Thank you, everybody.